Sexual Education for the Geriatric Population, presented by Janelle Blake, Gary Hewitt, and Evelyn Padilla. Statistics in the geriatric population. Safe sex among the senior adults are often ignored. HIV and AIDS. The incidence of acquired immunodeficiency syndrome, AIDS, has increased more than twice as quickly in people over the age of 50 than in younger adults. And this older population accounts for as many as 30% of the human immunodeficiency virus, HIV and AIDS, cases in the United States. If they do become symptomatic or learn that a sexual partner is HIV positive, older adults may be embarrassed to seek medical attention. If they do present with symptoms to a provider, the provider may not associate the symptoms with HIV, usually being diagnosed in a later stage in older persons. Thanks to better treatment, people with HIV are living longer. Ages 50 and older account for 45% of Americans living with HIV.
Chlamydia infections increased by about 52%. Syphilis infections rose by about 65%. Gonorrhea cases increased by more than 90%. The Centers for Disease Control and Prevention, CDC, reports significant increases in STDs between 2010 and 2014 among adults 65 and over.
Causes of increase in STDs. Living longer and increased health. Americans are living longer and in better health. About 53% of people over the age of 65 say that they are sexually active. Medications. For those who need assistance with erectile dysfunction, there are a number of drugs including Viagra and Cialis to help them get and keep an erection. Loss of a spouse and divorce. There are also more divorced older people than there were in the past decades. Couples over 65 were more than twice as likely to go through a divorce in 2014 than they were in the 1990s. So more are on the dating market. Condoms. Also, older baby boomers became of age when birth control was widely accepted. They are not the generation that was raised on condoms. Also, sexually active older persons who have sex with multiple partners may not consider using a condom because pregnancy is no longer a risk. They also have a misconception about sexually transmitted diseases, believing that these diseases only affect younger people.
Past societal expectations and ignoring senior sex life during exams. Part of the STD problem among seniors may also have to do with past societal expectations that older people don't have or want to talk about sex. In a New England Journal of Medicine survey, only 22% of women and 38% of men said they had talked about sex with their doctor since they turned 50. And doctors might not routinely ask questions about a senior's sex life during exams. That silence may be a particular problem for women. The vaginal lining thins after menopause, which can make older women even more vulnerable to infections than younger women.
Case study. A 70-year-old white man visited his primary care provider for symptoms of weight loss and fatigue. He reported a weight loss of 20 pounds and increased fatigue over the past 6 months. After undergoing neurologic testing, psychiatric testing, and routine laboratory testing to rule out cancer and thyroid disease, he received a diagnosis of Alzheimer's disease. When the patient needed a postoperative blood transfusion several years later, his activated power of attorney consented to an HIV test, and the patient was found to have AIDS-related dementia rather than Alzheimer's disease. The PCP, primary care provider, however, had never taken the patient's sexual history, assuming he was not at risk for an STD because of his age.
As this case scenario shows, Such a misdiagnosis can put a patient at risk for early death from lack of treatment and put both healthcare professionals and family members at risk for contracting the disease. To avoid situations like this, providers need to be aware of the most commonly observed STDs in older adults and understand how these STDs manifest in this population so they cannot make an accurate and so they can make an accurate and timely diagnosis.
Myths. Older adults are unable to have sex. Sex is not as pleasurable when you are older. Elderly are too fragile and weak. Older people are not as physically attractive and thus not desirable. Older people do not need or want to have sex anymore.
Benefits of sexuality and intimacy. Improving mental health and physical health. Improving mental health and physical health causes the brain to release endorphins and drastically reduce anxiety. Increased lifespan. Through its health improving benefits, a good sex life can add years to your life. Solidifying relationships. Sex is a chance to express the closeness of your deepest relationship. Security and comfort. Feeling important to and wanted by another person promotes security, comfort, emotional well-being. Benefits of sex. Sexuality also encompasses much more than physical acts. It includes love, warmth, caring, sharing between individuals.
Safe sex for seniors. In today's day and age, with more open attitudes towards sexuality, better health among older adults, internet dating, and the availability of medications like Viagra, many older adults are remaining sexually active. Unfortunately, older people are more vulnerable to sexually transmitted diseases, STDs, than younger adults. For older people, it is of the utmost importance to make sure you're practicing safe sex. Here are 4 tips on having and enjoying safe sex no matter what your age. Do a background check. Know your partner's sexual background before having oral, vaginal, or anal sex. All types of sex can spread STDs. Talk about your sexual histories and tell each other whether you've ever been tested for STDs, what the results were, and whether you've ever injected illegal drugs. HIV and AIDS can also be spread via shared hypodermic needles, though the most common risk factor for older women is sex with an infected man.
Consider getting tested first. The best way to protect yourself and your partner is for the two of you to get tested for HIV and other STDs before you start having sex. STDs don't always cause obvious symptoms, and some symptoms of STDs or HIV, such as fatigue, can be mistaken for age-related health problems. Use a condom and lubricant. Use a condom and lubricant every time you have sex until you know your partner's sexual history and are in sexually exclusive relationship. Water-based lubricants, such as KY jelly, are important because they can lower the chances of getting a sore or tiny cuts on the penis or inside the vagina. These sores and cuts can increase the risk of getting STDs. Talk to your healthcare provider. Your healthcare provider can offer additional advice about protecting yourself from STDs. He or she can also recommend treatments for common sexual problems such as vaginal dryness and erectile dysfunction, ED.
There are effective treatments for vaginal dryness, which ranges from over-the-counter moisturizers and lubricants to estrogen creams, tablets, rings that you would insert vaginally. Signs and symptoms of STDs. Though erectile dysfunction is more common with age, it is not an inevitable part of growing older. Rather, it is often due to underlying medical or emotional problems such as heart disease, diabetes, medication side effects, anxiety. Because erectile dysfunction may be the first sign of an underlying medical condition, it is particularly important to talk to your healthcare provider if you experience these problems. Knowing the signs and symptoms of STDs is crucial to early treatment. Some symptoms that are common with STDs, such as sore throat, frequent urination, lower abdominal pain, joint pain, fatigue, are also common symptoms of other health issues common to seniors. Since many may not think that seniors are sexually active, caregivers or family members may dismiss these symptoms. This means never getting diagnosed or receiving treatment. Provided are some resources. The first resource allows you to get STI testing with a lab at home. The second resource provides helpful information about sex education, sex questions. And the third resource offers a magnitude of resources, including books, blogs, education, consultants, plus more. So if you have any questions regarding sex, sexual dysfunction, STDs, you can utilize any of these resources for more information. Provided are our references, and we'd like to take the opportunity to thank you for listening to our presentation.